Good morning, everyone, and welcome to another Red Short webinar. My name is Bill Schenkelberg, and today I'll be talking with Ralph Wigner, who is the ISO at Catholic Medical Center in New Hampshire, Manchester, New Hampshire. So Catholic Medical Center is a nonprofit regional health system and one of New Hampshire's largest full-service medical centers. And I know that CMC, as we call it locally here, is really good with cardiac care. They're kind of known for that. So today, Ralph's going to share his top cyber issues that he sees in protection of his network at CMC. And just like we say every week, you can always find more information on similar topics at redskyalliance.org. If you've missed any of the previous Red Shorts, you can find them there as well on redskyalliance.org. So Ralph and I met several years ago at the local chapter of Infragard. And since then, we've kind of become good friends. I know at the time he was working for a banking system in the financial industry and then switched over to the healthcare industry. So, Ralph, if you can kind of give a little background on yourself and in kind of what you do at CMC, we could take it from there.
Great. Thanks, Bill. So I've got 36 years in IT experience. I've got my Bachelor of Science in Computer Science, Master of Science in Information Assurance, now cyber. I've been working in cyber since about 2000. I've got currently still have a couple of certifications, CISSP and CISA, but I've had some previous SANS certifications and CEH and things like that. Like you said, we're a mid-sized to large hospital here at Catholic Medical Center. My role is to manage the cyber team and manage all the cyber stuff over here. Soup to nuts. I've got a team of 4, including myself.
There you go. Sometimes having a small team is better and better to manage in that. So real quick, have you seen, is there a big, huge difference between the financial sector and the healthcare sector?
Oh,
as
yes.
far as cybersecurity? Oh, okay, good.
Absolutely, yes. Healthcare is regulated by HIPAA, and the banking industry is regulated by GLBA. And for whatever reason, federal regulators decided to probably, I guess, earlier. I'm not sure when HIPAA started or when GLBA started, but there are a lot stronger controls in GLBA. HIPAA is primarily concerned with patient data, whereas GLBA is a more overall thing. So it's different. We're trying to work towards NIST compliance, which we did at the bank also.
Right.
So our goals are always the same: is to make our systems as strong as possible, reduce risk, make our users smarter, protect systems, etc. The risks are the same, the methods are the same, but we're starting at a different level sometimes. So that's
Right.
good though.
So as we explained that, Ralph is in the healthcare sector now, dealing with HIPAA and everything, but healthcare, at least from my experience doing the cybersecurity for over 6 years now, healthcare used to be kind of somewhat of a hands-off sector as far as the ethics of hackers, if they have any ethics. But we see that around 2018 that there seemed to be a rise in hospital cyber attacks, and if you look at the graph there, you'll see the number of breaches kind of escalated in 2018. Last year, 2022, the medium breach affected more than 6,200 people, more than twice the size of the median breach in 2018. More than 52 million people had their private health information exposed in 2022 in more than 700 breaches, up from about 6 million people in 2010. So the pre-2018 cyber attack that you see on the bottom kind of graph there, you'll see that the bubbles there, around between 2015 and 2016, that was actually the Anthem breach. And this is just kind of my assessment. I think that may have opened up the doors for um, what was once an ethical hacking practice of not going after hospitals. That kind of all changed after that. And in 2018, there was kind of an escalation into attacking hospitals, unfortunately. So I asked Ralph for his top three topics as far as what he is seeing in the healthcare sector, and he mentioned ransomware, which is touching all 16 sectors, but specifically in hospitals. And unfortunately, some of these ransomware incidents actually caused deaths. I know several years ago in Germany, an ambulance had to be diverted from one hospital to another because they couldn't accept any patients because of a ransomware attack, and that individual died. And just not too long ago, here in the United States, a newborn baby died allegedly from the result of a ransomware attack that disabled the computers on every single floor in an Alabama hospital. So a lot of people think that kind of like white collar crimes, it's like it's a victimless crime. Cyber, especially dealing with hospitals, you're not talking about victimless crimes here. This is serious stuff. So, Ralph, what have you been seeing since you've been in the healthcare sector with ransomware?
So my daughter's a nurse in Vermont, and
Hmm.
so this hadn't happened to us, but you may know that there is a healthcare provider in Vermont that had ransomware a couple of years ago,
Right,
and
I do
she
remember that.
and she's part of that organization. She's a nurse, and
Hmm.
her, I mean, the direct results for her. She works in a clinic, and I'm sure all the hospital nurses and everybody else were that they ended up being down for a month. So their EMR, their healthcare main system was down for a month, which means that they had to do handwritten records for that month. They had to, uh, communicate by hand, track all that information, and then for another month after that, they were playing catch-up ball. Even though their system was back up, they had to load that data back into the system. So that was an extremely stressful time for her, and I'm sure everybody in that hospital system.
And that was a ransomware attack, right?
And that was a ransomware attack.
Wow.
So, uh, keep my fingers crossed. We haven't had anything like that here, but that's always uh, but primarily because in the last couple of years we've seen ransomware move in the healthcare sector to the healthcare sector be the number one sector affected by ransomware. So,
Hmm.
and I think you were talking before about it about healthcare and their records and stuff like that. I think the price of healthcare records on the dark web has gone up, maybe because there is more out there, but a kind of combination between those two. Um, it it's I think why ransomware has become so popular. Like you said, ethical or not, it doesn't really matter. The hackers, the cyber criminals, whatever, they go where the money is, and
Right.
so
Talking about the Vermont incident, I do
right.
remember that. Do, do you remember what was it a large amount for the ransom, and was it paid? Just out of curiosity, without
It
naming
was
names or anything.
a large amount. I don't recall at this point whether it was paid or not. I think it was paid, but I'm not 100% sure.
Right. And those decisions is to get back to operating, normal. That's why a lot of times, like not only the healthcare sector, but any other business that's attacked with ransomware, it's to get back to operations, right?
Right. So, I mean, I think the major point is in ransomware, how good are your backups, right?
Right. I was gonna
Uh,
I was gonna ask what's the remediation, or what's your plan for a ransomware attack? Right.
exactly. So you have to make sure that you have good backups at the very beginning, and then hopefully, if a ransomware hits you, then you have to go back far enough to where they weren't in there, and restore all your business records back up to, past the backups, because there's certainly going to be some point there. So that's a hard situation. And then
Right.
on top of all that, uh, ransomware is now a multi-factor attack, because as we've seen recently, uh, the hackers will embed themselves in there and then kick off the ransomware. And then even if you pay them off, they'll still sell your data anyhow.
Right. Right. Because they're
So,
still in the system. So
right.
has fragmenting, maybe I'm saying this wrong, but maybe can fragmenting your networks as far as like Internet of Things and your medical devices and that, keeping that separate from like billing and other operations
Correct.
within the hospital system, does that help?
Absolutely. Segregating your network lets you see via the firewall where the enemy is moving laterally, so you can track them down a lot quicker, kick them out, and then take it from there.
Right. Well, good. So the next question is, when we're talking about ransomware and ransomware attacks, a lot of times it's how do they get in? How's how does the bad guy get in order to place the malware on your system in order to create the ransomware, or ransom incident, I should say. And so a lot of times it's phishing. It's people doing things that they maybe shouldn't be doing, or falling prey to a phishing attack. So are you seeing that?
Absolutely. Phishing is something we see every day. Um, we see it from multiple sources. Sometimes we see it from our partners. Um, sometimes it's just a lot of times recently we've seen a lot of phishing from Gmail, because it's hard to track down somebody's account in Gmail. They can hide behind that pretty easily. Um, oh yeah, absolutely. So it's like you said, it's the doorway into ransomware and other attacks, along
Right.
with vulnerabilities. So if you unpatch vulnerabilities, we'll get them in the door. Another way to get in the door. But phishing, that's the primary avenue that we're trying to fight here, and using phishing simulations and training to train the end users, because they're really our front line. Train the end users to recognize what's risky and report it, so that if something starts up, then we'll get an early lead on it and block it if we can.
So when you say your partners, and in some industry they call it the supply chain also. So if an employee in any facet of the healthcare system sees something like an email coming in from a Gmail account, should that be looked at suspiciously right off the bat?
Right. If you don't know that sender, pretty much if you don't know the sender, that's the first part. But Gmail is not risky inherently, but it's, like I said, it's easy to hide behind. So,
Right.
and it's the latest thing that they send the
Right.
Gmail that's supposedly from our CEO. Okay, hopefully people realize that, but sometimes they click too fast.
Right. Yeah, haste makes waste there. But I'm just wondering, like with a vendor or someone in the supply chain, most companies have like domain names, so if you get a Gmail or like a generic type of a Yahoo or something like that, you should take another look at it, right? And scrutinize
Absolutely,
that, right? Right.
absolutely. You should scrutinize it. We have built into our email system, if it comes from outside of our network, there'll be a little yellow warning on it too, so that helps people recognize that a little
Oh,
bit.
good. Hmm.
And that's another method you can use. Um, we have some controls with our email defense system, and I'm sure most systems, I've used a few different ones. Most systems have something similar. They have checks for spoofing, so that if
Hmm.
your CEO has a Gmail account, for example, but he doesn't have a Yahoo account, and then you put it in there. This is a CMC account. This is a Gmail account. But if it's anything other than that, we're going to block it or warn people in an extra way. So there are a number of
Oh,
different
okay.
ways that you can protect from those types of accounts or uh, protect your highest value or users, for example.
Right. So I know phishing is kind of a segment of the overarching, social engineering aspect of it. And I know, many institutions, like you just mentioned, training your employees, they're getting better and more aware of phishing type attempts. Have you seen like a rise in some of the hackers actually placing phone calls to try and get, to social engineer through a phone call to get the same information that they would maybe get, via an email?
Absolutely. I'm not going to say there's a rise, but we've seen a steady flow of multi-pronged attacks. Like you said,
Mm,
phishing uh, could be texting, right? Smishing. That's another way that they try to get people to do that. And uh, in some cases, we've had reports of people's home emails being sent a message that was supposedly from our CEO. That can happen
right,
too.
right. Right. And I'm sure the COVID, when everyone or a lot of people were working at home, I know nurses and doctors and that, and patients obviously have to show up to hospitals even during that time. But a lot of during that time frame, people working at home, there were a lot of issues with phishing and spreading of malware and that.
Absolutely. I mean, that was a major change for the IT industry all over the place. We have to suddenly turn around and say we're going to let most of our back office people work from home if they need to. So that
Right.
adds some risk. You have to put additional controls in place. You need to do additional training to make everybody aware that what, you're working from home, but you're still connected to our network.
So we previously talked about ransomware and specifically with phishing and that, which is kind of my background, dealing with people and human nature and that. Whereas the data breaches, a lot of that is strictly or more IT. So you know, uh, I'll let you talk about the data breaches and like what you're seeing as far and some of the maybe remediation um, type measures that you're taking to prevent the data breaches.
Sure. So one of the ways that your average cyber person cyber team can use to protect against data breaches is data loss protection. In your email tool, you can put data loss protection in there so that in our case, if we see some HIPAA data or some credit card data going out the door and it's not supposed to, we can try to stop it or quarantine it or whatever. Uh, that's a major thing. Usually, most email DLP systems have checks for that or social security numbers, things like that to protect. Obviously, that's not the only way that data gets out the door. Uh, Unfortunately, or whatever it is, it's just a fact of life that we deal with. Our hospitals deal with a lot of outside customers, and sometimes they send CDs or DVDs or USB drives through the mail
Oh,
or some
right.
other way, and so that's a risk there too. So we have to advise our people on our end, on the billing side or on the medical side or whatever, that got that stuff coming. How do they deal with that? How do they get that into our system? How do they protect that data when they're done? Do they shred it? Do they do something else with it? All those different things are important. So I think those are the two main things that I see is obviously a data breach coming from us or to us. I mean, we've had actually data that was insecure come to us, and then all we can do is advise the other side that, hey, you know what, you shouldn't be doing this. You just put yourself at risk. And from our side, we can have more effect, more control, because we can actually have an automated control and then either get an alert or actually stop the data before it gets through the door. Uh, and then finally, I guess I didn't talk about this yet, but encryption, right? So when you're sending data across the wire, the data in transit, uh, if it's sensitive data, it needs to be encrypted. And we have a portal that allows customers to move that data back and forth. But we also have to remind our users that when they're talking to partners and stuff like that, and whether it's just sensitive company data, passwords, or uh, employee data or patient data, that they need to send it encrypted. And you should have a tool for that. And people in general should think about that when they're dealing with their medical data or their bank data or whatever, that don't just send stuff in the clear, because then it's exposed and it's pretty easily absconded with by Joe Hacker.
Right. So would you say, like, with these past three topics that you talked about, would be, training employees to use, when I used to teach security studies, I used to use the term, common sense is an instinct and enough of it is genius. A lot of times everyone has common sense. Everyone has different levels of common sense, but if you train people in the proper way, hopefully they can use that common sense and kind of be more aware of, not to get phished, not to, get malware or ransomware, on your system. And same thing if, like you were saying with some of the hardware coming in, like thumb drives and things like that. I mean, would you agree with that? A lot of that is training and common sense.
Absolutely, absolutely. And depending on how big your organization is, that can be hard, right?
Right.
Um,
Right.
a lot of times we have a lot of organizations have orientation training. So you're getting the people going through the door. That's usually live training, but not always. Um,
Hmm.
and so you can talk to them directly about these types of things, about protecting your information, about passwords, about phishing, things like that. You can also use either other live training, maybe go around to the different departments and train them all about these different subjects. Uh, that's a little more hands-on, better touch. Hopefully, you can answer their direct questions, so you can get much closer to the users that way, and have them, and also when you go around and visit them face to face, then they have a face that they can talk to and see and say, oh, this is a real person. We can reach out to that person if we need to. So
Right. Right.
but I
Good.
absolutely agree with you. Common sense, and you could use whatever words you want, but getting getting the users to understand that, and it's not just 60, 70, or 80-year-old people that are affected by this. It's 20 and 30-year-olds that
Right.
that don't understand what the risks are, and or sometimes don't care.
Right. Right. Exactly. Well, good. Next slide. Ralph, thanks for taking the time this morning to help our members and guests to gain some insight into, some of the current threats and vulnerabilities within the healthcare profession. It's a never-ending battle, with cybersecurity, with everything that we talked about, and I think everyone from the lowest level employee all the way to the CEO, has to have vigilance when it comes to cybersecurity. And I'd like to thank everyone for joining us here today, and hopefully this subject matter here, then the material that we presented to you, you found helpful. And again, Ralph, thanks for your helpful guidance, and hopefully it can be applied not only to the healthcare sector, but into really it affects all sectors. Like you were saying before, with the same type of techniques and that preventative techniques you use, can be applied to the financial sector or the manufacturing, or and in your case now the healthcare sector. So, any last comments, Ralph?
Just think before you click.
Yeah, that's a good saying to have. So anyone that's online here, if you have any further questions or anything about this subject matter, or really anything in cybersecurity, you can contact us via the two emails that are on the screen up top here. Mine is B. Schenkelberg at redskyalliance.com. You can also possibly get a hold of us through our two websites, or just Google our name and use any web browser and put Red Sky Alliance, and it'll take it right to our service here. So have a nice day, and we'll see you all next week on the 19th. Take care, and thanks again, Ralph.
Thanks, Bill and Red Sky. Have a great day.
Bye-bye.